Hi everyone. Today we will discuss about the most important topic of psychiatric post-traumatic stress disorder. We can call it as a PTSD. What is meant by post-traumatic stress disorder? PTSD is a psychiatric disorder that can occur in individuals who have experienced or witnessed a traumatic event such as a serious accident, war, natural disaster, sexual violence, or life-threatening situation is known as the post-traumatic stress disorder. Next, we will see what is the etiology of PTSD. Traumatic event, direct exposure, witness, or learning about the traumatic event. Risk factor, history of mental illness, lack of social support, childhood trauma, severity and duration of trauma. Neurobiological factor. What are the neurobiological factors in PTSD? Dysregulation of hypothalamic pituitary adrenaline axis, hyperactivity of the amygdala fear processing center, decreased activity of prefrontal cortex executive functions, reduced hippocampal volume, memory dysfunctions. Diagnostic criteria DSM-5 symptom must persist for more than 1 month and cause significant distress or impairment. Intrusion symptoms re-experiencing recurrent involuntary and intrusive distressing and memories, nightmare, flashbacks, avoidance symptoms, avoidance of reminders of the trauma, people, places, conversations, negative alternation in mood and cognitions, persistent negative beliefs about oneself or world, inability to remember important aspects of the trauma, where the patient cannot remember the important aspects of the trauma, feeling detached or estranged when the PTSD patients suffering from that, they forget about everything, they feelings detached to everyone, hyperarousal symptoms, irritability, angry outbursts. They will get irritability in small things and get angry in small thing, hyper vigilance, exerted startles response, sleep disturbance. They can't sleep properly during in the sleep. In the middle, they will wake up and think about the situation. Phases of PTSD, trauma responses phases, impact phases, immediate after the trauma, shock, fear, disbelief. Acute phase 2 to 3 weeks post traumatic intrusive, 2 to 3 weeks post trauma intrusive symptoms avoidance. Chronic phase, prolonged distress, functional impairment. There are the two phases, acute and chronic. Treatment approaches, pharmacological, SSRIs first line, sertraline and paroxetine is the first line drugs. This is very important. SNRIs, venlafaxine, prazosin for nightmares, benzodiazepines not recommended for long-term use, risks of the dependency, psychotherapy, cognitive behavior therapy, exposure therapy, cognition restoring, eye movement decentralizations and reprocessing EMDR. Group therapy and also supportive counseling, nursing management, establish trust and safety, provide a calm environment, encourage expressions of feelings, teach coping mechanism, monitor for self-harm or suicide ideations, and involve family in the care plan. Key points to remember for the exam. PTSD symptoms lasts greater than 1 month. Flashback and nightmares are the hallmarks features. SSRIs are the first-line treatment. EMDR is an evidence-based therapy. Hyperarousal includes irritability and exerted startle reflexes. Next, we will discuss about the post-traumatic stress disorder's most important MCQ according to exam-based. PTSD typically develops after exposure of chronic medical illness, option B minor social distress, option C traumatic events like combat, rape or disaster, option D genetic predisposition alone. Option C is the correct answer. Traumatic events like combat, rape or disaster. Option C is the correct answer. Next, PTSD arises from the exposure to life-threatening or the traumatic event. PTSD symptoms must last for at least, we have already studied, 1 week, no, 2 weeks, no, 1 month, yes, and 6 months, no. Option C is the correct answer. Diagnostic criteria require symptoms persisting greater than 1 month. A core feature of PTSD is option A mania, option B hallucination, option C re-experiencing traumatic events, option D delusion. Option C is the correct answer. Intrusive memories re-experience are hallmarks. Which of the following is not a symptoms cluster of PTSD? Option A intrusive symptoms, option B avoidance, option C euphoria, option D hyperarousal. Option C is the correct answer. Euphoria is not the typical in PTSD. Next, A veterans experiencing recurrent nightmares about the combat like has which PTSD symptoms? Option A avoidance, option B intrusive recollection, option C negative cognition, option D dissociations. Option B is the correct answer. Intrusive recollection. Option B is the correct answer. Nightmares represent intrusive symptoms. Next, PTSD patients often exhibit decreased startle response. Option B excited startle response. Option C no change in startle response. Option D none of the above. Option B is the correct answer. Excited startle response. Option B is the correct answer. Next, a patient with PTSD tries to avoid reminders of trauma. This is hyperarousal. Option B avoidance. Option C intrusion. Option D mania. Option B is the correct answer. Avoidance is a key diagnostic feature. Option B is the correct answer. Next, neurobiological changes in PTSD includes increase the hippocampal volume, decrease the amygdala activity, increase the amygdala activity, increase the prefrontal cortex functions. Option C is the correct answer. Option C. Hyperactivity amygdala is common. Next, first-line pharmacotherapy for PTSD includes option A antipsychotics, option B SSRIs, example sertraline, option C stimulants, option D anticholinergics. Option B is the correct answer. SSRIs are the first-line medicine. Trazodone is especially helpful for the depression. Option B flashbacks. Option C nightmares in PTSD. Option D mania. Option C is the correct answer. Trazodone reduces the nightmares in PTSD. Which therapy is commonly used for PTSD? EMDR, electroconvulsive therapy. Option C psychoanalysis. Option D light therapy. Option A is the correct answer. EMDR. EMDR is effective in processing traumatic memories. Next, in PTSD, the hippocampus is often enlarged. Option B, unchanged. Option C, decreased in volume. Option D, normal. Option C is the correct answer. Decreased in volume. Option C is the correct answer. Decreased hippocampal volume in PTSD affect the memory processing. Next, a patient startles easily at loud noises after trauma. This is re-experiencing hyperarousal. Option C, avoidance. Option D, disorganized thoughts. Option B is the correct answer. Hyperarousal. Hyperarousal. Option B is the correct answer. Next, which is not considered as a typical cause of PTSD: severe accident, natural disaster, financial worries. Option D, sexual assaults. Severe accident is a PTSD causes, natural disaster also, financial worries no. Option D, sexual assaults. It also PTSD causes. So answer will be option C, financial worries. Minor stressors like financial worries do not cause the PTSD. Next, DSM-5 requires how many symptom cluster for PTSD? Option A 2, option B 3, option C 4, option D 5. Option C is the correct answer. Option C is the correct answer. 4 clusters: intrusions, avoidance, negative mood, and hyperarousal. Hyperarousal. Next, a veteran avoids war movies because they trigger memories. This is re-experiencing. Option B, avoidance. Option C, dissociation. Option D, hallucination. Option B is the correct answer, avoidance. Option B is the correct answer. Option B, avoidance. Next, avoidance of trauma-related cues. Next, in PTSD, the prefrontal cortex is typically hyperactive, hypoactive. Option C, normal. Option D, enlarged. Option B is the correct answer, hypoactive. Option B is the correct answer. Next, reduces PFC activity leads to impaired regulations of fear. Next, one difference between acute stress disorder and PTSD is presence of nightmares. Option B, duration of symptoms. Option C, exposure to trauma. Option D, intrusive thoughts. Option B is the correct answer. Duration of symptoms. Acute stress disorder lasts 3 days, 1 month. PTSD lasts 1 month. Next, a patient says, I feel detached from everyone. This is option A, dissociation. Option B, intrusion. Option C, avoidance. Option D, negative alternation in mood. Option D is the correct answer, negative alternation in mood. Feeling detached is a part of negative mood or cognitions. Which of these is not a risk factor of PTSD? Option A, child trauma. Option B, high social support. Option C, history of mental illness. Option D, severity of trauma. Not a risk factor. Not a risk for childhood trauma is a risk factor. High social support, not a risk factor. History of mental illness, also a risk factor. Option D, severity of trauma, also a risk factor. So answer will be option B. Next, which gender has a higher prevalence of PTSD? Option A, men. Option B, women. Option C, equal. Option D, no data. Option B is the correct answer, women, because women are higher prevalence of the PTSD. Women have higher risk due to types of trauma like sexual violence. Next, PTSD flashbacks are example of avoidance. Option B, intrusion. Option C, negative consumption. Option D, disinhibition. Option B is the correct answer, intrusion. Option B, flashbacks are a form of re-experiencing. Next, cognitive restructuring in CBT helps PTSD patients. Option A, suppress memories. Option B, avoid triggers. Option C, reframe negative thoughts. Option D, induce amnesia. Option C is the correct answer. CBT addresses distorted thinking. Next, which statement by a PTSD patient need priority follow-up? I avoid the news because it reminds me of the trauma. Option B, I don't want to talk about what happened. Option C, I sometimes think about ending my life because of the memories. Next, I get jumpy when I hear loud noise. Option C is the correct answer. I sometimes think about ending my life because of memories. Suicidal ideation requires immediate interventions. Next, EMDR involved in passive listening. Option B, rapid eye movements to process memories. Option C, antidepressant use. Option D, group therapy. Option B is the correct answer. Rapid eye movements to process the memories. Option B. EMDR involves bilateral stimulation to process trauma. Next, the primary nursing goal for a patient with PTSD is reduce the psychotic symptoms. Option B. Enhance social support. Option C. Eliminate all memories of the trauma. Next, reinforce dependence. Option B is the correct answer. Enhance social support. Social support is a protective and promotes healing. Which of these drugs is typically not used in PTSD? Sertraline. Option B, paroxetine. Option C, haloperidol. Option D, venlafaxine. Option C is the correct answer. Haloperidol. Haloperidol is an antipsychotic, not first line for the PTSD. A veteran with PTSD says he is always on the guard. This is an option A, avoidance. Option B, re-experiencing. Option C, hypervigilance. Option D, delusion. Option C is the correct answer. Hypervigilance. Option C. Being constantly altered in hypervigilance. Next, which of the following best describes the impact phase of the PTSD? Option A, feeling of safety and calm. Option B, shock, disbelief, confusion, acceptance of trauma. Option D, resolutions. Option B is the correct answer. Shock, disbelief, confusion. Shock, disbelief, and confusion. The impact phase involves acute emotional reaction. Next, in PTSD, which area of the brain is involved in storing traumatic memories? Option A, cerebellum. Option B, hippocampus. Option C, basal ganglia. Option D, hypothalamus. Option B is the correct answer. Hippocampus. The hippocampus stores memory and is altered in PTSD. Thank you everyone. We'll see in the next video with a new topic. Stay happy. Thank you.